Hello, I'm Dr. Christopher Brennan, founder of Long Island Aftercare. I created Long Island Aftercare because I saw firsthand how overwhelming and confusing the healthcare system can be for patients and families. Imagine this scenario. You come to the hospital by ambulance because you are having chest pain. In the emergency department, you are evaluated by multiple physicians and specialists. After testing, you are admitted to the hospital for a heart attack. But during your evaluation, doctors also discover several other medical concerns. Your urine testing suggests a possible urinary tract infection. Your blood work shows elevated BUN and creatinine levels, meaning your kidney function may not be normal. Your family also reports that you had confusion, altered mental status, and slurred speech before arriving at the hospital. Now suddenly, many specialists become involved in your care. Cardiology is evaluating your heart attack. Nephrology is evaluating your kidney function. Infectious disease is evaluating the urinary tract infection. Neurology is consulted because of the slurred speech and altered mental status. That is a lot of doctors, a lot of information, and a lot of different conversations happening every day. To make things even more confusing, sometimes a different physician from the same specialty group may see you each day during your hospitalization. After 3 days in the hospital, the kidney specialist walks into your room and says, "Your kidney function has improved. From our standpoint, you are okay to go home." Later that afternoon, infectious disease comes in and says, "Your urine culture came back negative, so we can stop antibiotics. From our standpoint, you look improved." Now imagine how that sounds to a patient or family member. Several doctors are saying things like, "You look better," or "You can go home from our standpoint." Then a family member opens Epic MyChart and notices that a possible discharge date is listed as Friday, May 15th, 2026. But today is only Wednesday. Immediately, anxiety and fear begin to build. Now you and your family believe you are definitely being discharged in 2 days, even though you do not feel ready. You have barely gotten out of bed. Every time physical therapy comes to evaluate you, you are sleeping or unavailable, and they tell you they will come back later. No one has fully explained whether you are strong enough to safely return home. You are scared, you are confused, you are overwhelmed. And remember, you originally came in with chest pain and are still on a heparin drip, a blood thinner used for heart attacks. Cardiology has not yet explained that they may still be planning a cardiac catheterization to look for blocked arteries in your heart. Meanwhile, you live at home. Your children live 20 minutes away, and now you are trying to imagine how you could possibly manage at home in only 2 days. At this point, the hospitalist physician covering you earlier in the week is off today. Then Dr. Brennan walks into the room. It is his first day meeting you and your family. Before anyone says a word, he can already see it in your faces. The fear, the confusion, the frustration, the unanswered questions. So instead of rushing through the encounter, he sits down, and together everyone starts again from the beginning. The first thing I want to know is simple. Are you receiving all of the medications you normally take at home while you are here in the hospital? If the answer is no, I ask the patient and family to review every medication with me. Then I explain, in the simplest terms possible, why certain medications may temporarily be held during hospitalization and when I expect them to be restarted. Next, we go through everything that led up to the hospitalization. What symptoms started first? What happened at home? How were you functioning before you came into the hospital? Usually, care managers begin evaluating these issues early, sometimes while the patient is still in the emergency department. Do you normally walk independently? Do you use a cane, walker, or wheelchair? Do you live on the first floor? Do you need to climb stairs at home? Do you have support from family members? These details matter because after several days in a hospital bed, many patients become weaker and less mobile than they were before admission. A patient who was previously independent may no longer be safe walking alone, but we do not know that yet until physical therapy and occupational therapy complete their evaluations. Then comes the most important part of the discussion. I sit down with the patient and family and clearly explain the overall plan of care. At some point, the family usually points to the whiteboard in the room and says, "The staff wrote that discharge might be Friday." This is where communication becomes critically important. I explain to the patient and family in the calmest and simplest way possible that many physicians may be involved in their care, but there must be one person coordinating the overall picture. I tell them, I am the hospitalist. I am the captain of the ship. Every consultant plays an important role and provides recommendations within their specialty. But when it comes to the overall coordination of care, safety, discharge planning, and making sure everything comes together properly, that responsibility falls on the hospitalist. I coordinate with the consultants, nurses, care managers, therapists, and the rest of the healthcare team. And most importantly, I reassure the patient and family of one thing: you are not being discharged unless it is safe. I explain that projected discharge dates placed in the chart are often tentative planning dates used for coordination purposes. They are not final decisions. I tell them, listen carefully to what every specialist says because their input is important, but understand that discharge decisions are made based on the entire clinical picture, not just one specialty. Sometimes I even joke with families and say, if you did not hear it directly come out of my mouth, then it is not officially happening yet. And finally, I give patients and families something that many people desperately need during hospitalization: accessibility, reassurance, trust. I provide my cell phone number so they know they can reach out to me directly with questions, concerns, confusion, or if they hear something that does not match the plan we discussed together. Because when patients and families understand the process, fear decreases, trust grows, communication improves, and healthcare becomes what it should have been all along: clear, compassionate, coordinated, and centered around the patient and family. Thank you for watching and welcome to the Long Island Aftercare platform. We encourage you to explore our new Patient and Family Education Center at liaftercare.com, a growing educational knowledge base designed to help patients, families, and caregivers better understand the healthcare journey. Our platform answers many of the most common questions people have during hospitalization, discharge planning, rehabilitation, recovery and post-hospital care, and more. We understand that during stressful medical situations, emergencies, or after receiving difficult news, it can be overwhelming to absorb and remember everything healthcare professionals are explaining. That is why Long Island Aftercare was created, to provide clear, easy to understand educational resources that patients and families can access anytime at their own pace. Be sure to explore our powerful Map Resources section, which allows you to search and filter healthcare facilities and services throughout Long Island and surrounding areas based on the criteria most important to you. You can filter by affiliated healthcare system, clinical capabilities, inpatient versus outpatient services, specialty care, rehabilitation options, skilled nursing facilities, home care services, county location, and much more, helping patients and families make more informed healthcare decisions. Our goal is to improve communication, education, transparency, and healthcare navigation for patients, caregivers, and families during some of the most challenging moments in life. Please follow Long Island Aftercare on our social media platforms for ongoing educational videos, healthcare updates, patient resources, and new content. YouTube, Facebook, Instagram, X. Thank you again for watching, and thank you for being part of the Long Island Aftercare community.